myself Stavani, and today I am going to go through blood pressure monitoring. Here we go. Before we start the procedure, make sure you hand hygiene and gain consent from your patient. Did you have any catheter prior to 30 minutes?
No.
Did you smoke prior to 30 minutes?
No.
Okay, today I am going to check your BP monitoring. Is that okay with you?
Yes.
Can you please place your hand on the table? I'll be placing the cuff over his arm. Make sure the cuff is 2.5 centimeters above the antecubital crease. Now we'll be palpating the radial artery and we'll be inflating the cuff until we no longer feel the radial pulse. Cuff. Now I will be palpating the radial artery and rapidly inflating the cuff until the radial pulse disappears. So this will be our estimated systolic reading. So now I will be adding 30 mmHg to the estimated systolic reading. Now, in the next step, I will be palpating the brachial artery and placing the bell of the stethoscope over the brachial artery. So, and slowly deflate the cuff for every 2 to 3 mmHg. So the first sound what we hear is what we take as perk of sound, and that will be the systolic reading. Continue to deflate the cuff until the sound disappears and note the level of the reading, and this is what we call as diastolic reading. So I hear the first tapping sound around 110 and the sound disappears at 70. So that would be 110 by 70. Hi, myself Stavani, and today I will be performing mouth and oropharynx examination. We'll start by inspecting the lips. Observe for the color and moisture, and also note if any lumps or find any ulcers. So now we will be inspecting the oral mucosa. For inspecting the oral mucosa, we need a proper light and a tongue depressor. We'll be inspecting the oral mucosa, the color, and if you find any ulcers or any lumps and any white patches. Can you open your mouth? So now we will be inspecting the gums. Normally the gums will be pink, and then also we will be palpating the teeth with the help of the thumb and the index finger. Now we'll be inspecting the tongue. We will be asking the patient to protrude his tongue, and then we will be inspecting the symmetry of it, the test for hypoglycemia. Can you protrude your tongue? Now with the right hand, grab the tongue of the patient with the help of the square of gauze to the patient's left and inspect the sides of the tongue. Now we will be inspecting the color and the architecture of the heart pellet. Can you open your mouth? Can you say huh?
हाँ
Again,
हाँ
again,
हाँ
again.
हाँ
Note the level of the soft pellet. A test for vagal nerve. Shravani, and today I am going to demonstrate lung examination. So before we undergo the assessment of lung examination, perform hand hygiene and gain consent from the patient. Start the inspection. Looking onto the chest wall for any deformities or asymmetry. Looking for intercostal muscle space. Now we palpate the back, looking for any tenderness or pain. And also looking onto the structures. Okay, can you hold your hands like hugging yourself? Okay, thank you. Now I will be checking for tactile firmitas with the help of the bulb of my hand. Can you say 99?
99 99 99 99 99 99 99 99
Now I am going to place my hands around the thumb tip and span my fingers laterally across the rib, and with my fingers I would push the middle so that I can get the skill fold over here. Now can you please take a deep breath in? You can see when he took deep breath in, my thumbs go in direction with him and my thumbs got expanded together. This is what we called as lung excursion. Percussion. Here we use the middle finger of the non-dominant hand on the surface of the area you want to percuss, and with the middle finger of the dominant hand we will give a strike on it. So now the next step will be the diaphragmatic excursion. It is a diaphragmatic movement between full inspiration and full expiration. So what we do now is determine the level of the diaphragmatic dullness to be between T7 and T10. So this will be the baseline. So when we do the exhalation, we will be tapping from upward. So when we do inhalation, we will be tapping downward from resonance to dullness. So this is what we consider as diaphragmatic excursion. This will be having a slight variation on the right side as we having the lever over the right side. The diaphragmatic exertion will be placed 2 centimeters above. So now we are going to end with the auscultation of the posterior of the lungs. Whenever you feel my stethoscope on your back, just give a deep breath in and out. Okay. So whenever you feel my stethoscope on your back, say 99.
99, 99, 99, 99, 99, 99.
Okay, now whenever you feel my stethoscope on your back, just whisper 1, 2, 3. Okay. Now the last one is echophony. Now I am going to place the stethoscope on your back and now listen to your lungs. Can you please say E every time I place the stethoscope on your back?
E, 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 E.